So I'm Melissa Hanson. I'm from McGill, and this work was done in conjunction with the Reimagining the Practice of Surgery Task Force, and I'm really excited to play my video, and it will kind of go for itself. In recent years, our community began to talk more openly about burnout, moral injury, imposter syndrome, and physician suicides. With the current stressors facing physicians in 2020, we wanted to explore how surgeons are creating joy and meaning in their careers, what challenges they are facing, how they are overcoming them, and what advice they have for the next generation of surgeons. We conducted a series of interviews. This video is a small glimpse into the lived experiences of some of those surgeons.
What does it mean to be a general surgeon? It means everything to me. It's my raison d'etre, if you will.
When you're in the OR, when you see patients afterwards, I still have that feel of, wow, somebody pays me to do this. When I see a resident of mine who's able to do an entire procedure from skin to skin, and I don't have to do anything, I feel so proud.
I mean, to this day, the thing that gets me up in the morning time most days of the week is I get to go in and operate. In their own words, I feel a lot better. Can't believe the hernia is gone. Can't believe I'm not leaking anymore from this GI tract thing. That is extremely rewarding, right? To know that I did that thing.
I had this joy in what I did, and even my then girlfriend, later fiance, and now my wife of 36 years, she would even make comments like, you're really tired, but you're really happy.
But really nothing has really, changed my passion for my craft. I still love what I do. I can't imagine doing anything else. I compensate and combine it with other things that give me pleasure, like teaching, traveling, for sure. And research, clinical research is very important to me and become an increasing part of my focus. There's this awesome sense of responsibility towards your patient that is quite unique. And I think it's a combination of the trust that the patient put in you, because of what you do to them, and that relationship that you enter with them, which is often lifelong. That degree of trust, it puts you in a very special place with with respect to your patients. And I don't think there's any other profession that can, that has that same exact experience.
This is actually, there is a problem. You assess the problem, make a decision of what you're going to do, you do it, and I'm saying you, the surgeon, does it, and then all of a sudden it's done. The patient wakes up and little by little recovers, hopefully everything goes well, and you made a change in that patient's life.
I'm a surgeon, I help one person at a time, but it's still very fulfilling to do that.
It's this thought that I can offer something that other people don't, or cannot necessarily, is at least one of the nice motivating factors.
There were times when I was a resident when I was going to quit the program. There were times when I said, I've had enough of this. It was rarely because I was working too hard. It was mostly because I felt like I wasn't being treated properly by the people that I was working with.
I almost quit surgery. Between my third year and my fourth year, I almost quit. I was burned out. At the time, burned out was not really a thing. No, really, everybody was burned out. What the biggest problem was the way I dealt and managed stress.
And we make these series of short-term commitments, and when you finally get into your first job, I think many of us have this kind of moment of, wow, this isn't quite perfect. And I thought I was earning perfection by all this stuff I've committed myself to. My whole adult life has essentially been put on hold in a way to get to here. And here isn't perfect, and I didn't see that coming.
I was super goal-oriented, super process-driven, and all I wanted to do was climb that ladder, get the next thing, get the next grant, get the next paper out, and kind of do better than everybody else. And kind of after a while that got to me, and I kind of got really overwhelmed and I had a bit of a burnout. I had to take some time off, and I felt this was like really early in my practice that this happened. Everyone said I was a little bit precocious in this. I went through my midlife crisis at 35 rather than at 50.
For sure, some of the hardest days in surgery, in my experience, have been when a patient has gone wrong.
You need a group of people, or at least one other person, but it helps to have more than one, I find. A group of other people that you can just reach out and go, oh my God, this happened. It never completely goes away. You'll always think of some of the extremely sad patient outcomes that, whether you are correct or not, that you blame yourself for.
I take personal complications like to heart a lot, and I do struggle over them, and I think that like it actually has gotten harder over the course of time, because I think internally I'm like, you should be much better than this.
I think that's the most underestimated burden of doing what we do, is the weight of the things that don't go well. And we all probably have graveyards in our heads.
I think the struggles and the pain you suffer when you have a patient that is not doing well come from the exact same place where the enjoyment comes when the patient does well. And if you see it like that, then you start to realize when you're going, now, well, if I wouldn't be suffering like this, that means that I wouldn't be enjoying it when my patients do well either.
I think it's important to not lose track of like taking care of yourself, because if you do that, then if you can't take care of yourself and you go crazy then you're not doing anyone a favor. You're not doing yourself a favor. You're not doing your patients a favor. And you're not doing your family and friends a favor either.
Relying on the people around you is important. Nobody can do it all by themselves. It's not your responsibility alone. You have a team that you work with, but you also have a social circle. And whether that's like I said, your partner, your family, your friends, these are important people that are an important part of your life.
I have made conscious decisions not to do things in my career that I would have liked to have done from a career standpoint, but I knew would be hurtful. And I have to say there, it's not like I had this great wisdom. A lot of that came through my spouse and my family and friends who could look at it and say, I don't know what you're thinking there, but let's talk about that. And having those people in your life and choosing to give them voice is really important.
We need to do a better job when we're training our residents to make them understand that we all reached out. And none of us showed up as this full-formed, completely invincible surgeon the day we stepped out of residency or fellowship.
Everybody deals with the same challenges. Everybody has those moments when they feel like they're struggling, and we're all in it together.